Thank you, Senator McCormick.
Thank you all for being here. Mr. Baker, can you describe what level of transparency already exists for American healthcare consumers with regard to what country a medicine or its APIs are from, and what improvements could be made to ensure Americans have better insight and understanding on the origins of their medicines?
Yeah, at the moment, the transparency in the supply chain as far as what patients know about where their medications are made is virtually non-existent. There could be some improvements in the labeling. It's a complicated issue because there's many players in the supply chain as outlined already, from the key starting materials all the way to the finished drug. So we would have to take a risk-based approach where the most critical step, like for example, if it's an aseptically filled product that's intended for injection, the step in a supply chain at which that product was aseptically filled in a sterile environment would be on the label. It's not a perfect solution, but it's the best we can do to help increase transparency and let the market fix the issues as already outlined by my colleagues.
Thank you. And Mr. Daniels, how can technology and AI be deployed for hospitals and others to map their supply chains? I know you touched on this at some level. And what can be done to advance any reshoring or nearshoring of drugs and APIs?
Thank you, Senator McCormick, for the question. So first, hospitals are mapping their supply chains. We work with multiple hospitals across the United States to map their supply chains. They also, in large part, go back to large distributors, right, that are intermediaries between those hospitals and the actual drug manufacturers or medical device manufacturers or PPE manufacturers. But the key first step is to use artificial intelligence to actually break down that bill of material of each of those pharmaceuticals and then tie those back to the literal suppliers that those pharmaceuticals are coming from. But the thing is, you can't just map the products you're buying. You should be mapping the products you're not buying. And what I mean by that is you should understand the spectrum or the panoply of alternative suppliers that you have available to you prior to a major disaster. The customers of ours, we're endorsed by the American Hospital Association as the risk management technology company for all U.S. hospitals. And the customers of ours that had our software deployed knew almost a month in advance that IV fluids would be subject to disruption due to Hurricane Helene. And so that kind of visibility, of course, it can lead to the stockpiling point that we just made, but it also can save American lives, especially in operating rooms. The second question you had was on the reshoring. I mean, first, Senator Johnson brought up this point. One of the biggest issues we have is permitting. We have a huge backlog and delays in permitting of new facilities and capabilities. The other thing is a lot of this stuff is pretty dirty to make. So acetaminophen, just taking as an example, creates a waste broth that the EPA would not allow us to dispose of in the way that India or China does today. And so one of the things that we have to look at is that there are novel ways to actually manufacture these. And these aren't novel ways that are not taken to scale yet through BARDA and multiple other programs that are looking for advanced research and development capabilities in emerging biotechnology. In BARDA, we've actually taken some of the continuous flow manufacturing capabilities to scale. So first, if we can permit, we can actually make it cost effective. And then the second thing is, with AI and automation in the actual manufacturing line, we take away the single and only differentiation between us and emerging markets in manufacturing pharmaceuticals at scale, which is labor arbitrage. Yeah. And so implementing AI and automation inside of the pharmaceutical manufacturing process, I mean, there are places in North Texas that are cheaper than places in Shenzhen, right? We can start building these factories and actually start competing on a global basis.
Great, thank you. Mr. Chairman and Ranking Member, thank you for having this hearing. Great topic. Thank you.